So sometimes they might be like that. We might, here's the sulcus. So you need to put look for the pins in the various structures. So, okay, so what I want to do is get the book out and kind of go through all those so I don't miss any. So again, you're going to have to look at yours, but also hopefully other structures are going to be out. So the pericardium, was cut off, so you can see this pericardium here. So we might have the big, blob of it, but this is going to be that sac around the heart. So the epicardium is going to be on top of the heart, and if you push around, you should be able to see a membrane that's on the surface, and you can probably break through it, and it might be pulled up a little bit off the surface of the heart. So apex, where's the apex?
Point.
It's the point, okay? And I don't think any of the hearts had, usually if these vessels are cut away from the heart, we can get that ligamentum arteriosum. So, but I didn't see any that were cut that far. So that's probably not going to be on the test. Auricles, where are those? Auricles, yeah, so these things that look like little ears. Remember, auricle is a structure of your ear, the outer part of your ear. So auricle here, it's the auricle. So left, right, and left. So the atrium, that's going to be, the larger structure. So it's going to be all that, including the auricle. So it's part of it. And then we have ventricles. Which side is this?
Right.
Right. And then this one is
The left.
the left. So left and right ventricle. And then we have pulmonary artery. The pulmonary artery is going to be one that looks like a tube, and you can usually see that pulmonary trunk coming right off of the right ventricle. So that's the Q is where it's coming from. So you have the pulmonary artery. The pulmonary veins are going to be collapsible. They usually don't look like garden hoses. They're these collapsible ones that then enter into the left atrium. So this was cut for the prep, but this one would be a pulmonary vein going into the left atrium. Sometimes there's two. Sometimes there's just one. I don't think I saw more than two for the ones that we had. So here's the second one. So you can see that probe connects with that one. So that's also a pulmonary vein. And there's the third one right there. So this one has three. The aorta is going to be the one coming out of the left ventricle. So if you look in your pigs and shove your probe up through the left ventricle, you're going to see the aorta. So this is the aorta. Again, it looks like a garden hose if you look at it from above. And then the first blood vessel off of the aorta is the brachiocephalic. So that's the brachiocephalic artery. So this, again, it's going to be a tube. And this guy actually even has stuff coming off of it. So jugular's coming off. So what's next? Aorta, superior and inferior. So you kind of have a sense that pulmonary, aorta, brachiocephalic are on the forward part. Another one coming from above, but usually a little bit to the right and to the back, is the superior, and it's collapsible. So here's superior vena cava. Inferior is going to come from below, but going to that same position. So you want to shove your probes in and find the inferior. So the inferior is down below, again collapsible. There's hardly, you can't even see it when you get your probe out of it. So you need to superior, inferior. Okay, the sulcus is interventricular between the ventricles. So this is on the front of the heart. So that's going to be our anterior sulcus, and then the one on the back is straight down. So that's also, you can see it goes between the ventricles right here. So this one goes straight down, this one curves around. Okay, interior, where's the myocardium? Easily seen on this one. So the myocardium is where on this?
Thick muscle.
Yeah, so that big thick muscle, myo's muscle. Endocardium is going to be on the inside, so it's that shiny membrane on the inside.
Like under the myocardium?
No, it's on top of. Well, if you're going in, it's this shiny
Right.
right here, I guess, if you under, I guess. Going superficial to deep, it's deep to the myocardium.
Okay.
Yeah. Likewise on this side, you should see shiny, glossy, that's the endocardium right there. And if you were good, you probably could carefully pick away and pull that membrane off of the muscle. The pectiate muscles are just going to be these ones that you see here. You could see ribs of them. Ribs, 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 ribs. Those are the pectiate ones. You also see them in the auricles. So the auricle ones too, they look like just ribs of muscle. Tricuspid, bicuspid. Tri is the first one you hit if you follow the flow of blood through the heart. And you should count 3 flaps, separating the atrium from the ventricles. So 1 flap, 2 flaps, and then a 3rd flap, separating atrium from the ventricle. Bicuspids on the left side, you should see 2 flaps. So 1 flap and then a 2nd flap, and you may have cut through it when you did your dissection. So it should be 2 flaps, separating atrium from the ventricle. Moderator bands on the right side, you can see that clearly. It's going to attach the two so you don't get overstretched here. So then we have chordae tendineae. Those are all those cords that connect the flaps to the wall of the or here, these cords here. So connecting the flaps to the muscles. The papillary muscles are these little fingers or little nipples. Papillary muscles. You have them in the left as well. Semilunar valves, you got to look up into the arteries. So again, you're looking for little flaps, and they look whitish. They're kind of a different color than the muscles. Sorry. So you look, there's 3 of them, and they're going to prevent backflow. So you can see they're pointing out of the arteries, or up into the arteries. You're going to see them on the other side as well. Atria, ventricle again. From the inside, the coronary sinus is going to be on the right side. So this is why you wanted to cut through that superior vena cava. And so if you open up that superior vena cava and look towards the inferior vena cava, there's the inferior vena cava. Stick your probe in, you can see there's a hole underneath it. So you'll see 2 holes. One is the inferior. If I can get that out again. One's the inferior, and then there's another hole there. That's the sinus, coronary sinus. The septa are going to be those bands that separate the ventricles. So interarterial and interventricle, again,